easier for you to do that. So the first medication that we have is ibuprofen, which we know is an NSAID, also known as Advil and Motrin. Those are some of the more common names. And I have this little dumbbell right here. It'll make sense with the next slide. But it is to remind you that the max dose that you can have per day is 3,200 milligrams. And we use NSAIDs because they help with that inflammation suppression. We can also use it for analgesia for mild to moderate pain and also as a fever reducer. We want to be very, very careful in patients who have peptic ulcer disease and active GI bleeds. If they have these present, you do not want to give these ibuprofens. You want to call and question that order to make sure that the provider is aware that that was ordered and what's going on with the patient. We also want to make sure that we question any order if this is given to a pregnant patient, and we can get more into this later on in the maternal because there is a certain point where you can use it cautiously, and then there's a point where you can't use it at all. So just for right now, just know, hey, if they're pregnant, we probably want to question that order, and then we want to use this cautiously in our clients who have heart failure. So interactions would be any anticoagulants because that is going to increase their risk for having bleeding if you use the anticoagulant and NSAIDs used concurrently. Glucocorticoids are going to increase our risk for gastric bleeding. Remember, guys, NSAIDs are very, very irritating to that gastric mucosa. We want to do the same for alcohol. That's going to increase our risk for gastric bleeding. Ketorolac is another NSAID, and so we don't want to overload them with NSAIDs because your poor little kidneys are going to be crying for help. And then don't forget herbal supplements that already have those anticoagulant effects. So I have this right here, your 4 Gs, garlic, ginger, ginkgo, and ginseng. And then, of course, we have feverfew, but it doesn't start with a G, so I didn't include it right there. Be very cautious with that because that's going to increase our risk for bleeding. So some very common adverse effects is going to be some GI discomfort, including like dyspepsia, that abdominal pain, heartburn, nausea. And like I said, it is very, very irritating to that gastric mucosa. So we have to be very cautious with that. We want to make sure that we're monitoring for signs and symptoms of any kind of GI bleed or even picking up on risk factors that the patient might have already that are going to add to their risk of having a GI bleed. And then you always want to be very, very aware of monitoring their kidney function because it can be pretty hard on their kidneys. So, watching their urine output, making sure that we don't have weight gain from that fluid retention where their kidneys aren't able to excrete that urine. And then, of course, watching our BUN and creatinine levels because those will give us a picture of how well our kidneys are doing. So some nursing considerations are basically going to be monitoring for those signs and symptoms of a GI bleed. And after our GI unit, you should be very well versed in what the signs and symptoms of a GI bleed are like. And then just making sure that we do our patient teaching. And so, advising them to take ibuprofen with food. That's going to decrease those GI symptoms and that GI irritation that can happen. Tell them to avoid alcohol when you're using ibuprofen. And reporting signs and symptoms of a GI bleed. So that way we can get them in and get them checked out. And then, of course, always telling them that they need to report any over-the-counter medications because we know that these are herbal supplements that can very much interfere with our ibuprofen.